Doc, good morning.
Good morning. Thanks for having me.
How are you? Look at you.
Oh, man.
What do you got cooking today?
Just some hand and wrist surgeries. Just taking a little break between them.
You're God bless you. We always talk about Rothman doctors and how you guys keep us in motion, keep us doing what we love. And geez, the hand and the wrist, all those bones, all that complexity. I mean, God bless you, because that area of the body is so complex. I can only imagine, what you're doing.
Yeah, a lot of stuff going on. A lot of injuries that can happen, and a lot of people coming in with those injuries. A lot of things to fix. A lot of things to take care of for sure.
Well, let's start with our rookie, VJ Edscombe, and the
I know.
thumb, Doc. I'm an idiot because I'm like, let the kid play. It's the thumb. Let him play. Tell us about it. Tell us about the injury. Tell us about the thumb. And I know we know that you're not treating VJ, but you as an expert can talk about the injury itself.
Yeah, obviously I haven't seen him. I don't know what his situation is, but thumb injuries are very common. So I can go through some basics for the thumb. So basically, I think I can get it on. I can see it on my video, but not on yours. But anyway,
I got you.
So the thumb is three main bones here, here, and here. And there's three joints actually at the bottom of the thumb and in the middle up here. So you bend right there. The main issue with this guy's thumb, most likely, the most common injury is this joint right here. So the thing that's holding these joints together are ligaments. It's not just like a little like a piece of, a little piece of string or a little rope holding it together.
Sure.
These ligaments are thick fans, a very thick, strong tissue holding it all together. And what can happen is these ligaments can get injured. A portion of them can get injured. So you think of them as a big, thick, like this. A portion of it can get injured like this, and it can still be stable and heal okay. So when you talk about thumb injuries in sports, that's the main joint that's getting injured. About 80 to 90% of the time, that's getting injured. So you worry about how stable that joint is. And you can test how stable it is by putting some stress on it. If you think about holding like a ski pole in that hand, and if you jam that ski pole down, it'll jam your thumb back. It's something called a skier's thumb, is an injury that will almost dislocate that joint. And when you talk about treatment for an injury like that, and it's not just skiing, obviously any sport where you're using your hands, getting it jammed up against someone, against a ball, against the ground, you worry about, is it stable or is it not stable? So you test it by, if you can push it one way or the other, it goes too far, that's when you can have an issue with it being unstable. So if it's unstable, you talk about certain treatments, and if it's stable, you talk about some other treatments. And then it's the physical exam first, and then you talk about getting imaging, such as an X-ray, and then you can step it up to get an MRI. The X-ray is going to show you your bones, if there's any broken bones, crack, fractures around that joint. That can be a problem, obviously. But then you get an MRI to take a look at the soft tissue of those ligaments. So a combination of the, what were you gonna say?
No, I'm fascinated by this because when the injury started, they called it a contusion, and then it became a sprain.
Yeah, so it's a really a combination of, all right, so what happened here? He comes in with or whoever it is, comes in with a sore thumb, and maybe you don't get quite a good look at him first, or you're just on the sideline and say, oh, my thumb hurts. Let's take a look at it. All right, maybe it's a contusion. So then you get, like, maybe later that day, the next day, come into the office or get him set down at the training table, get a better exam on him, say, oh, maybe it's hurting right in this joint. And maybe this is more of a sprain. And then maybe you're able to get more advanced imaging to take a look what's going on. So then you kind of combine your exam to see how stable it is. You look at the imaging to see what's going on there. And then you have maybe you have a stable injury with a negative imaging. Maybe you have a stable exam with some worrying imaging, and then you maybe have an unstable exam. And if it's an unstable exam, most likely imaging is going to be pretty worrying on an MRI or something like that. And then you get into treatment options and then moving forward.
What's the typical time frame, right? Like when you look at the timetable on something. Now, I know it varies, obviously, with severity, but with rehab, the whole thing. If it's just not serious enough, what's that sort of time frame?
So with the any stable injury, imaging looks fine, and maybe there's a little sprain of one of these joints.
Yeah.
The thumb's a tough one because it's kind of out on its own. Has to basically be a backdrop and basically hold restraint and keep everything stable against all your other fingers. You can sprain these fingers, and literally, if you look at any basketball court, volleyball court, everyone has straps between their fingers, like buddy straps, buddy tape, keeping them all together, and that keeps it stable enough. You can go back basically right away. The thumb's a little different. If there's any instability, or if it's not comfortable, or if it's sprained and not comfortable to use, you have to stabilize it with some sort of, either a cast or a brace or a splint. And depending on the severity of the injury, what it is, and depending what sport you play, depending what position you are, getting back to using your hand completely normally with no restrictions could be up to past 4 to 6 weeks at least. But getting back to playing with some sort of protection can be quicker than that. But could be in that 4 to 6 week range, could be within a few weeks, could be up to 6 to 12 weeks, depending on how the injury is. So it really depends on the injury, but the thumbs are just a little tougher, especially in a sport like basketball, football. If you're, in a skilled position, you have to protect it as it's healing, whether or not something you repair surgically, or if you can just treat it without any surgery.
Yeah. I mean, obviously, just shooting the basketball, just that kind of movement, it will hinder it. So yeah, it's fascinating.
Yeah, if you look if you look at this, if you pinch about 1 pound of stress through this point right here, about 3 pounds goes through the next joint, and the joint we're talking about 6 pounds goes through that joint. So it's a lot of forces going through those joints. It kind of gets increased as you go up into your hand.
Doc, you guys always fascinate us. I mean, you teach us. It's so interesting. The tools of the body. It's amazing. God bless you too. You look great in the scrubs, ready to go, man.
Serious.
It's game time for you.
Exactly. Yeah, we're always ready to go whenever we're needed, for sure.
Thanks, Doc. We really appreciate your time very much. Your insight, it means a lot.
All right. Thank you very much. Appreciate it.
There he is, Dr. Bryan Hozack, checking in from Rothman Orthopaedics.